Hello, my name is Yolanda Wingster, and today I have with me Yambria Pierre and Yolanda Musgrove. They're both RNs at Regional Rehab Hospital. Today we're going to briefly discuss what it means to be culturally competent and deliver culturally competent care. So Yolanda, what does being culturally competent mean to you?
Being aware of different cultures and some beliefs that they may have in relationship to medical care, such as like I had a patient that was Arab. She was Muslim, and the particular doctor that we had on was a male doctor, but her husband did the majority of the speaking and explained to us that a male doctor couldn't see his wife. So respecting that and being competent in that, we were able to get a female doctor from a different floor to come in and see her.
That's wonderful. That's an excellent explanation of culturally competent care. It's a learned system of knowledge and behaviors, attitudes, beliefs, and values towards a certain group of people. It's what their norm is versus what we may think normal may be. As providers, we need to be aware of the attitudes and beliefs of different groups and their behaviors, and we need to respect those beliefs and attitudes and not be judgmental when it's something that they do versus something that we would do. It's pretty much the key to the do's and don'ts for each group. So the importance of culturally competency in healthcare. What does that mean to you, Yambria? Why is it important to be culturally competent in your work setting?
Well, I feel as though if you're being culturally competent, that you're able to provide each patient with a certain amount of care and respect so that they feel as though they are receiving the appropriate care.
That's good. Culturally competent care by providing culturally competent care, it gives you a means to provide the optimal care, to provide holistic care towards an individual. It provides a foundation of communication and skills, awareness of social issues, and health beliefs within a culture. The patient-centered approach identifies and negotiates different lifestyles of communication, decision-making, preferences, roles of family, sexual and gender issues, and the issues of mistrust and prejudice. So once you provide culturally competent care, how does this help to improve the patient outcome? If you have an ill patient, let's say, and you're able to provide them care based off of their values and their beliefs, how do you think this affects the way that their treatment progress will go?
Well, in the facility we work in rehab, I think that it's going to improve the outcomes of hopefully going home versus delaying the care.
That's correct. If you're able to provide culturally competent care in a way that would help to improve or progress the treatment process, then the patient will be able to likely go home back on their baseline and they'll be able to resume their normal functions prior to their hospitalization. So let's talk about some ways that we can deliver culturally competent care. Yolanda Musgrove, give me some ways that you think we can deliver culturally competent care to our patients.
For one, respecting on admission, a lot of times we do ask do they have some religious preference or some things that would prevent us from caring for them. It can be as simple as what we think is simple as no pork. If you got a patient that's for religious reasons or for their cultural, don't eat certain foods, we would respect that. Simply filling out a dietitian sheet could make the difference of how they feel about being here in the hospital. Another one is, we have a patient as far as getting blood. We have some patients, due to religious reasons, they don't want to receive blood, and respecting that and still giving them the maximum amount of health, secureness, and feeling like they can still accomplish the things that they want to accomplish as far as their outcomes. So I believe with being patient-centered, it has to be about the patient. And you can't take into those things in consideration and have it to be about the patient. If it's not about their cultural, how do you say it's patient-centered if you don't respect that and put that into consideration?
That's good, and I'm glad you mentioned the blood issue because On our PowerPoint, you will see that one of the ways that we can deliver culturally competent care is to recommend and negotiate treatment. And that is a prime example of negotiating a treatment on a patient that does not accept blood products. We may be able to offer another treatment option in that event. We can also familiarize ourselves. One of the big things that we deal with different culture is a language barrier. We can try to familiarize ourselves with certain words, such as how to express pain, or how to say pain, or going through our assessment. Certain familiar words that we may use during the assessment process. If we're not able to, we need to have resources on the side where we can get that done, such as a language line or a translator on hand. Assessment is very crucial in developing a culturally competent care. There we can do our interview and we can find out some of their beliefs. Listening will be an important aspect of finding out their beliefs, their behaviors, what their illness means to them. If they delayed to seek treatment, why did it take so long to seek treatment, and what can we do to prevent it from happening into the future? So let's get into talking about a specific population and treating a specific population as far as their culture. And we're going to talk about the Hispanic population. And according to the 2008 U.S. Census Bureau, the Hispanic population represented approximately 15% of the United States population. Hispanics come from a collective culture where group activities are dominant. The median income of Hispanics is lower than the U.S. average. Getting diseases is a bigger concern than dying for the Hispanic population. The father or the oldest male is usually the head of the family, and they usually make the decisions for the family. The father or the oldest male may decide to delay treatment for family members until they're very ill or bedridden and they see treatment is necessary. Male Hispanics especially may be reluctant to seek treatment. Hispanic individuals, they often look to other family members for opinions before they go to healthcare providers. Hispanics have the highest uninsured rates of any racial or ethnic group within the United States, which may also affect their treatment, delaying treatment. Research suggests that lack in health insurance results in fewer visits to the primary care physician. And as we know, that fewer visits to the primary health results in chronic diseases, which could possibly have been prevented if treated at an earlier stage. A relevance or traditional healing system is common for the Hispanic population. They like to use a lot herbs versus our medical treatment that we may take. This is culturally approved, but also because they get their herbs at a lower cost. They're uninsured and they're able to get the herbal medications and treatment from the herbal medications at less cost. So let's discuss, have you ever treated, besides the Hispanic population, culture outside of your nationality, and you dealt, and there were ways that you had to kind of relate to to a culture change?
Yes, we had an African patient here before, and he was not very accepting to the female nurses.
Oh, okay. Yeah. That's common also. That's probably common in a lot of cultures, not males not wanting females, and females not wanting males to take care of them. So to sum everything up, culture insight helps to communicate with the vulnerable population more effectively. If you familiarize yourself with different cultures, you're able to communicate with them more effectively and provide better health care. Lack of cultural competency can lead to chronic diseases. As nurses, it's very important for us to educate the vulnerable population and try to get the resources that they need to get the medical assistance that they need. Cultural diversity results from the unique nature of each culture. Culture is the center of most populations' health habits, which means that each culture will seek treatment based on their cultural health habits. Do you have any questions?
No, not right.
Well, thank you.
Well, thank you.
And that will conclude our brief discussion on cultural competency.